own hospital system that we have. And as of the end of last week, we only had 4 people on vents, 8 people in the ICU, and 28 non-ICU beds. And so our total bed count was at 36. So that was really good. At one point, we were highs up into the 90s. And so we're doing really well with hospitalizations and medical surge. So the couple of things I want to point out about our partnerships is we're continuing to work with the Clay County School District, looking at case interviews, the contact tracing. We have a great partnership there. We actually have access to their data system to look up the seating charts, but also to be able to look at attendance records of students that have been there, but also those that have been exposed, so that we can promptly and immediately get those students removed from the school so that they're able to do their isolation or their quarantine period. Currently, we're still doing same day, next day contact tracing. And again, we've hired at the Department of Health 23 additional full-time staff members that are just working on COVID efforts. Lastly is our partnership with the Clay County Sheriff's Office. We continue to maintain contact with the new sheriff, Michelle Cook, and along with the jail administration. That is a congregate setting, so it always is going to have a higher risk exposure for any individuals because they live, eat, sleep, everything there. We've done some recommendation guidance out of the CDC for them in order to help mitigate the strategy or mitigate the process that's happening right now. We've looked at cohorting and how those look, looking at how do we cohort positives together, how do we cohort people that are symptomatic together, and then how do we take those that are negative or asymptomatic and put them in other dormitories. We looked at things like enhanced cleaning, social distancing, making sure that the inmates have use of masks if they would like to, and limiting their movement. We currently have done some testing in the jails. As of Friday, we sent in a 3-person investigation team to do interviews with all those positive cases and look at the contact exposures. We also sent in a 2-man team today to do additional testing, and then we're going to start on a rotation of every 2 weeks testing in the jail setting so that we can identify those individuals that are positive and immediately isolate them. And again, doing same day, next day contact tracing. And the last thing, as a prevention message, we are coming up onto flu season. This is the year, if you're contemplating flu and getting the vaccination, that you would want to do the flu vaccination, for the simple reason that we simply don't know what that's going to look like this year, with COVID being another type of respiratory illness that could be a mitigating factor, or a compounding factor upon the flu season. So at this point, I'm going to turn this over to Michelle Cook, the sheriff.
Thank you, Heather. Good afternoon. So let's talk numbers. As of this morning, we have 156 positive COVID-19 cases in the Clay County Jail among our inmate population. This is out of a jail population of 472 inmates. We have 8 detention deputies that have tested positive as well. We have 104 total deputies that work for us. We are working closely with the Clay County Health Department and Heather Huffman and our emergency manager, John Ward. I think something that's really important to note is that those folks who are in our control and custody and our care have full access to medical personnel 24/7. We have a physician available at any time when called, and we have a full staff of nurses in the jail 24/7. So if any inmate is showing any signs or symptoms of anything or have any medical complaints, there's somebody right there who can take care of them. We are continually monitoring our staff and our inmates, and we are taking measures to isolate and quarantine individuals who have symptoms, tested positive, or have refused testing. Let me say this. These efforts began back in March when COVID first started breaking out, and this is something that the Clay County Sheriff's Office has been very diligent about doing, is taking these precautionary measures to keep people from getting sick. However, like Heather described, this is an area where people eat, sleep, live 24/7, and so it was really only a matter of time before either an employee or a new inmate brought COVID-19 into the facility. Now that it's here, we're doing everything we can to keep everybody safe. For our employees, we require that our employees wear masks and appropriate PPE. We are providing additional hand sanitizer to all of our employees, and we check our employees' temperatures at the beginning of each shift before they come into the facility. For those inmates that are in our custody and care, they are screened when they are brought in and immediately isolated and or quarantined depending on if they have any symptoms or have a fever. We continually monitor the inmates for symptoms. We provide masks to the inmates. We provide additional cleaning items for the inmates to clean their areas. And again, they have access to medical personnel 24/7. For our actual facility, we sanitize and clean continually. We took in possession this past week in a disinfectant fogger that we're utilizing throughout the jail now with an additional cleaner that happens 2 or 3 times a day. We are utilizing negative airflow cells. We are sanitizing all of our dishware and utensils after each use. All of our inmate programming has been suspended. We have limited our inmate work crews, and we isolate and or quarantine any inmates that, again, have tested positive, refuse testing, or show any symptoms. We have had these preventative measures in place, and we continue to keep those in place and add these additional members. As Heather stated, we are going to be doing additional testing in the next 2 weeks. That's the current status of the Clay County Detention Facility, and at this point I'm going to turn it over to the county manager, Howard Wanamaker.
All right, good afternoon, ladies and gentlemen. I want to thank our newly elected sheriff, Michelle Cook. We appreciate the strong partnership and relationship between her office and the Board of County Commissioners. I also want to thank all of our first responders and healthcare professionals who have tirelessly worked since March to keep us all safe during this pandemic. The unified command team continues to be strong and committed to lead us through these unprecedented times. Together, we work daily to reopen, rehire, and reunite Clay County. Remain in step with Governor DeSantis' safe, smart, step-by-step plan. And I want to thank you all for doing your part. A few reminders that I have for you all. We are still under a local state of emergency for the COVID-19 pandemic, and will continue to extend this weekly as necessary. Please avoid congregations and groups larger than 50. Senior citizens and individuals with significant underlying medical conditions are strongly encouraged to avoid crowds and to limit their risk to the COVID-19 virus. Finally, please continue to use the Clay County Government Switchboard at 904-284-6300 to make appointments to conduct business here at the admin building. The economic recovery process from the COVID-19 pandemic may take a long time. Federal funds are based upon population. Please, let's all do our part and be counted, and visit 2020census.gov. Thank you all, and stay safe. We'll now open for questions. Yes, ma'am.
Any questions for Sheriff Cook?
Okay.
Yes, ma'am.
First, I wanted to know, is it deputies or corrections officers who have tested positive in the jail?
Our detention deputies.
Detention deputies?
Yes, ma'am. We have 8 of those.
Understood. And you're mentioning the 2 weeks for testing. So when did that start? I mean, why is it 2 week separation between when they can get tested?
I'm going to defer to our county health officer, who can go into details about the timing of the testing.
Understood.
So as you know, with COVID-19, the infectious period is 14 days. And if we went in today and tested everyone, we may catch some negatives that are truly in that early process of the virus. We call them false negatives. They just haven't been able to shed enough of those proteins in order to test positive. And so what we're doing is we're hoping, again, at any time somebody comes symptomatic, we can test them. But as far as doing a whole congregate setting, we're doing that every 2 weeks to be able to catch some of those that may be in that false negative range, and also some of those new inmates that come in. Unfortunately, it's just not as simple, the testing, as you've heard over and over from us, related to, if I catch you this one time, that's the be-all, end-all, and we just know that isn't the case. Again, if there's any symptomatic individuals, we can do those in between this 2 week period, but that is what we've been going to. That's what we've used in the other congregational settings, nursing homes, ALF, is testing it in that format, really to be able to capture those, along with all of our increased infection control practices, but be able to capture those ones that may be asymptomatic for sure.
Right, that was going to my next question. Do we know of any asymptomatic far as a number so far, or?
You want to talk about it? Currently in the facility, our 156 positives are showing some symptoms. We don't have anybody that's in severe medical distress, but all of our folks are showing some symptoms. It could be a runny nose or a slight cough, but that's where we're at this point.
Can you go into detail about the isolation process that you were mentioning when someone comes in, they do the 7 days and they're put into the general population, but after we have tests and looking at what we have right now, what does isolation look like inside the jail right now?
I'm going to call Director Coldiron up to talk about that. He actually is the Director of Corrections and can speak to that. Chris?
So can we get your first and last before you start?
It's Chris Coldiron, Coldiron. We have an initial isolation period of 7 days. We've now extended that to 14 days. So with the extended that to 14 days, they're not allowed to leave a certain cell block area. Once that 2 weeks is up, hopefully we'll have the new testing that will be coming in. So then if they are positive, we can actually put them in a dorm that has other positive inmates. If they're negative, we put them in a dorm that will have the negative inmates.
So negative inmates are with negative inmates?
Yes.
Understood. What's the turnaround time for getting the results back?
So we've done really well with testing. At one point we were 5-7 days out. We're now about 36 hours out, 48 hours out. So the testing is turning around fairly quickly now. So that's the good news. Good news is that we're able to identify them quickly, get them isolated, do contact tracing, and then that way we can limit the amount of exposures.
And this may be a question for you. How many beds are in a cell block?
We have about 8 different types of cell blocks. We have some that have 10 beds. We have some that have 67 beds. And we have some that are single beds, like in our confinement single beds, medical single beds. But in our open dorm population, you have several of those that are 67 plus inmates at each one. So it makes it different challenging components for us to do the separations that we need to do.
Right, because I'm thinking how many are in a block that have tested positive and that are separated from another?
Well, of the dorms that we have separated, we have 156 inmates that are isolated from everyone else, but they're in groups housing together.
Understood, okay. And I just want to make sure, it's 8 out of the 104 deputies, correct?
Yes, the 104 in detention security.
Understood. Okay. Thank you.
Sheriff,
Yes, sir.
the 156, that does not include inmates who have refused to be tested, or does it? You said some of them have refused to be tested.
No, it does not. We've had about 60 or 70 that have refused testing, but we treat them as if they are positive, and so they are put into the positive group. Just better safe than sorry at this point.
Okay, so they do count as the 156? They don't?
No, they don't.
We just isolate them the same.
We've just isolated them the same, yes, sir.
So technically, so you have 156 plus as many as 70 that are isolated totally.
Correct. And I'd like to commend our detention folks, first for going so long without COVID-19 being introduced into the facility. That's actually remarkable, considering our general population sits between the 470 and 490 range. And to go from March until mid-September, early September, before we actually get a case of COVID introduced. And then very quickly, as soon as we realized we had it, they were on top of it, putting these additional measures in place to quarantine and isolate those that had tested positive, getting the testing in there, taking the additional steps to make sure everything was cleaned thoroughly even more. So they from the time they knew about this to the time they were putting measures in place was within hours.
And so right now, inmates are going to be tested every 2 weeks,
Inmates will be tested every 2 weeks.
and that has started when? When did that start?
Well, it rotates. Yeah, let her speak to it.
So just a couple of things on the testing. So we identified a couple of positives, and that's when we started doing more testing based on, we had always been just doing symptomatic, or we were doing some testing based on when inmates were also going to another receiving facility. Those receiving facilities were mandating negative tests. And so as we identified positive cases, we have realized we needed to do more testing, because we simply just don't go in and test for, in a type of setting like that. So as we realized there was an outbreak going on, we went in and did testing. So we're wrapping up that testing now. When you talk about almost 500 people, that's a large amount. And it's not as simple as drive-through, as you can imagine. And so we're wrapping that up today. That's what the 2-member team from my staff and the testing site went over to assist with. Then they're going to be on the 2-week rotation starting at the end of next week. So it'll be a little bit shy of 2 weeks. Some people will be a little over the 2 weeks. Some people will be a little less than the 2 weeks. Then we're going to start those rotations to be able to capture those ones. And we're hoping that that will be the end of the testing based on how many cases are identified in 2 weeks. Okay?
Chair, if I could just ask a couple.
Yes, sir.
I wonder if you could touch on, we've heard from some families of inmates that have said that they haven't been able, at least last week, were not able to speak with their family members. Are you able to say whether the phones were not available to inmates last week?
I am not aware of any issues. Yeah, if you want to speak to that.
In some of our dorms, we're in the process of getting visitation pods, so they can actually do a video visitation. So with that, with the time frame in there that they weren't able to talk to them, that would be the areas that we would have concern with that. But the phones have not been cut off. There was a technical error 2.5 weeks ago where it was down for a day and a half, but that was unrelated to the pandemic. It was a technical issue with our vendor.
And I wonder if you could speak a little bit to the process. I know cleaning is probably a big deal right now inside the jail. Are sheets and things like on the inmates' beds, clothes, for example, are those being kind of regularly cleaned? How is that working?
We do a linen exchange twice a week. That's clothing and linens, and mask change twice a week. We've actually increased some of our washing chemicals that we use in those from them. Then the mattresses are cleaned at the same time. The tables and common areas are cleaned 3 times a day in the cell blocks. It's a very concerted effort on staff and even the inmates wanting to make sure that their area is very clean.
And I wonder, as you guys kind of look at it, have you been able to narrow down where the outbreak might have started? Has there been maybe a specific dorm where all of the inmates ended up testing positive? You can kind of maybe provide some context.
It would be unfair for me to make an assumption on that because of how long the pandemic has been around. It could have been a staff member. It could have been someone who had contact with an attorney that came in at one point in time. So there'd be no way for us to technically narrow it down to that, the patient zero that you call them.
Yeah. Well, we call it an index patient, but yes. So we're not able to, we're still in the process of interviewing all these inmates. And again, sometimes with the testing, it's a little problematic because just because someone tests first doesn't mean they had it first. Because we don't know when we test positive, we don't know if they're on day 3 or day 14. So we don't typically know that. And so again, it's the chicken or the egg that came first. So that's a little bit of a problematic. So we're still doing those interviews. Like I said, I had a 3-member team go in on Friday and we interview each individual inmate that was positive. So we still do that normal case interview. And based on that data is when we are able to go back and try to identify the start of that outbreak. We do know that it was in multiple dorms, and so we've been able to try to work with Director Cold Iron this week and the end of last week, really looking at how do we cohort those individuals, do a better job of that quarantine period at the beginning when new people are coming in, we simply don't know their status, and being able to identify those ones that are symptomatic and get testing promptly so that we can isolate them.
And then just last question, I imagine when you're talking about nearly half the population in some capacity having to be isolated, whether positive or not, what are some of the inherent difficulties that might come with, per se, the design of the facility or things like that?
You should do a tour. I can say, to say we're isolated inmates, we have to isolate inmates with the type of patients they're with, the type of other personnel they're with, because to say we can have no inmate movement throughout the jail is going to be impossible because you have different things that come up, sentencing changes, incidents within the jail. So with that, we've identified several different cell blocks of identified type of patients or inmates that we're going to have in there. So it gives us some options and where we actually can put them, where we can't put them.
Okay, and sorry, are you able to add the additional 60 to 70 that are being isolated and refused testing? And can you say how many of those might be asymptomatic?
I wouldn't have that number right now.
You said the county's reported about 4,500 total cases.
Yes, sir.
How many active cases right now would you have? I mean, is that
So we don't truly track recovery data because that definition's a little fuzzy, a very subjective recovery. So we don't track recovery. Ideally, we could go back the 14-day period and say these people are currently active in an infectious process, but we don't track that data, so there's no way to give you a specific number. I can tell you our top months in June and July, we were having over 100 and some cases a day, versus now you're typically, other than those few days that we saw, we did quite a bit of jail testing, we were running in the 20s and 30s a day. So you can see a third of the numbers that we were seeing in our peak in June and July. The other thing that's interesting with that is we were very concerned with Labor Day. We had huge upticks from Memorial Day and 4th of July. A lot of people gathered when we probably shouldn't have. And so we were concerned with that with Labor Day. We have not seen that. We're not quite to the 14-day window yet, but we have not seen in the state or in Clay County a huge uptick from that type of gathering scenario that happens on those holidays.
And also, do we have any numbers from schools?
So we do track schools. We've been doing case investigations and all that. I believe the school district today, and I don't want to speak on their behalf, is going to be doing a very as transparent as they can be type of little dashboard. The state is still working on a dashboard that's related to schools and that data. I know the governor has asked for that. Unfortunately, our system just doesn't have that data readily available to pull data out of in that manner. We've never had a pandemic, so we've never had this amount of volume. So again, we're still working on that, but the school district is in close communication with us. I talk to the chief of staff 3, 4, 12 times a day. It just depends on what's going on. We try to troubleshoot all of those cases, look for issues that are going on, identify those students quickly, make sure they're not attending school if they're in a quarantine or an isolation order, to make sure that that's not happening. And we've done very well so far, knock on wood, but I want to make sure that we continue on that same trend.
Another question.
Sure.
And maybe for corrections. We're getting reports of lack of air conditioning.
We do have some airflow issues in the jail. We're working with the county to get some of those resolved, bringing in some additional air handlers to try to push the air around. But we do have some issues, and like I said, we're working with the county and getting some of our chillers replaced within the next fiscal year. But we do have some issues, but it's not unbearable. It's just not very comfortable.
Even during the pandemic.
Yes.
Can you say what areas of the jail might be affected by that?
I'd say a third of it. I mean, I'm not going to give the exact dorms that we're dealing with, but it's about a third.
Thank you.
Thank y'all.